Hi, everybody. This is Dr. Stephanie, your double board certified critical care physician, and I work with physicians who are struggling with their jobs, burnt out with their careers, or who just want career advice. Through my books, webinars, coaching, and speaking, I help physicians discover alternative jobs and careers in medicine so they can practice medicine on their own terms. Hi, Dr. Yvette. Thank you for joining. And why are you on Facebook when you're supposed to be in Africa? But anywho, I'm glad you're here, and I can't wait to hear about your amazing trip to Rwanda to teach ACLS at one of the hospitals there. That's absolutely amazing. Thank you for joining me. But I wanted to take some time to talk about on this Monday burnout. Now, Medscape just released their 2020 report entitled National Physician Burnout, the National Physician Burnout and Suicide Report 2020. And this report every single year always just gives me some insight about what we physicians are facing as a profession. You know, we all know that burnout is at an all-time high, is at an epidemic amongst physicians. In my opinion, burnout is really a national health crisis because it is forcing physicians out of medicine. Now, as we know, burnout is widespread. According to this report, 42% of physicians report being burned out, and I think 51% of women physicians report being burned out. The specialties that are affected are critical care medicine, and I'm an intensivist, so I can attest to that because I have experienced burnout firsthand. So critical care medicine, emergency medicine, family medicine, internal medicine, neurology, and urology are the top specialties reporting burnout. But here's the thing that I found really jaw-dropping. We all knew this, but we needed to have somebody else tell us this. According to Dr. Frank John Ninivaggi, who is an expert on physician burnout, he is a physician himself, the leading cause of burnout amongst physicians is administrative burden and as it pertains to the workplace and organizational culture. So let me repeat that. The leading cause of burnout, and we all know this, but we just needed somebody to verify this, to validate our feelings. The leading cause of burnout for physicians is administrative burden and the workplace and organizational culture. So what does this mean? It means, number one, that burnout is completely preventable, period. Burnout can be prevented because if the number one cause of burnout is administrative burden and the workplace culture, that can be prevented. Number two, burnout is treatable because it's caused by a preventable factor. We can treat burnout. And number three is reversible. But here's the thing that's so tragic about this is that so many physicians have been forced out of medicine because of their burnout and they just couldn't take it anymore. And it's really sad that physicians have been forced to leave medicine because of something that is preventable, treatable, and reversible. And burnout adversely affects other aspects of physicians' lives. It affects our health, it affects our relationships, just to name a few. So burnout is preventable, burnout is treatable, and burnout is reversible. And the thing is that is so sad about the situation is because many physicians are forced to leave clinical medicine, or they feel that they have to leave clinical medicine. But here's the thing. After they leave clinical medicine, after they get treated for burnout, oftentimes they want to go back to clinical medicine because they never fell out of love with clinical medicine. They just fell out of love and started hating the way they were treated as a result of having to practice clinical medicine. What do I mean by this? According to this Medscape report, top causes of burnout: too many bureaucratic tasks, too many, having to chart all the doggone time. EMRs absolutely drive you crazy because it's always they're popping up some kind of alert, and it's almost like death by 1,000 clicks. And then it's always something we need to chart, we need to fill out, we need to do something. And my primary care physicians just report horror stories about the amount of paperwork they have to do and the amount of phone calls they have to do and things like prior authorizations. So it's too many bureaucratic tasks, too many hours at work. lack of respect from hospital administrators, your employers, your colleagues, and your staff. So all of those things contribute to burnout. But here's the thing. Hey, Dr. Cumby, how are you? Thank you for joining. So here's the thing. So after physicians take some time away from medicine, step back and heal from the burnout, they still yearn to be physicians and they still yearn to treat patients. But the thing is, and this is the travesty of it all, and we all know this, after you've been out of clinical medicine for 2 years, it is nearly impossible for you to get back in. So physicians are being forced out of medicine due to burnout, due to something that is completely preventable, reversible, and treatable. And if you're out of clinical medicine for an extended period of time, you can't get back in. And that is a travesty. So what is one supposed to do? Well, I recommend doing 3 things if you're a physician struggling with burnout. 3 things before you make the decision to walk away from clinical medicine. The first thing you need to do is to get help. So Dr. Cumby says this is so timely. I'm glad it's timely because we're faced with the crisis here. You know, I cannot tell you, Dr. Cumby, how many physicians I have talked to over the last week who have said, you know what, I was burnt out from medicine and I walked away from clinical medicine, but now I'm ready to come back. I'm ready to come back, and I'm glad they're ready to come back. But the thing is, if you spent too much time away from clinical medicine, you may not be able to come back. It may be more of a journey. So what we need to do is, before we make that decision, that fateful decision to walk away from clinical medicine, to quit medicine, there's 3 things we physicians need to do. First of all, you need to get help. You need to get help. You need to reach out to a mental health professional. Okay. And I know there's we can go and we can talk a whole nother Facebook Live, a whole nother conversation about why many physicians are reluctant to do that. But there are mental health professionals that are willing to help you deal with this burnout. Secondly, in addition to getting help from mental health professionals, reach out to other physicians so that you know that you are not alone. Just the mere fact of reaching out to somebody else and saying, this is what I'm struggling with, will give you validation to your feelings. It will let you know that you are not the only one, and it will make you realize that you are not the problem and that more than likely your job really does suck. So number 1, get help. Number 2, we are physicians and we do this every day. Develop an assessment and come up with a plan. So what do I mean by that? You know, we do this every single day as physicians. We assess the situation, we listen to our patients, we take in all of the information from what they're telling us, all of the objective data that's available, and we come up with an assessment of really what's going on, and we come up with a plan. So if you are feeling signs of burnout, you need to come up with an assessment in terms of, why are you burnt out? What is it that is causing you to feel this way? Is it the fact that you feel like you are dying from having to chart all the doggone time? Is it the fact that you are up to your eyeballs in administrative tasks? Is it the fact that if you feel like if your pager goes off one more time, that you are going to actually throw the pager in the toilet? Is it the fact that you are spending more time at work, more uncompensated time at work than you should be spending? Is it the fact that you have to go home and complete paperwork and complete your charting? Is it the fact that your administrators think that you're replaceable and treat you like a cog in the cogwheel? Is it the fact that the staff does not respect you? Is it the fact that your patients take you for granted? So whatever it is that is adding to your burnout, we need to identify that and pinpoint it, and then we need to come up with a plan. We need to come up with a plan, because here's the thing. According to research, according to data, and according to your own experience, burnout is preventable, treatable, and reversible. And the number 1 cause of burnout is administrative duties, administrative burdens due to the workplace and organizational culture. So a cure for burnout could be something as simple as doing whatever you need to do to decrease the administrative burden and all of the administrative tasks you have to do, and or finding a less toxic workplace environment. So what does this mean? It means that your cure for burnout could be something as simple as you need to find another job, period, point blank. Develop an assessment, come up with an assessment, and develop a plan. So the first step is to get help. The second step is to develop an assessment and come up with a plan. And the third thing that you need to do before you decide to walk away from clinical medicine, and the third thing you need to do before you decide to give it all up and say, you know, I'm done with this, I'm hanging up my white coat, I'm hanging up my stethoscope, is to try locums. What do I mean by that? One of the top causes of burnout, besides administrative burden, toxic workplace culture, feeling unappreciated, is also loss of autonomy and loss of control. Because according to this Medscape report, physicians who are in private practice report less burnout because they control everything. Locums gives you back some of that control, because as a locums physician, you have control over everything. You work when you want to work. You work where you want to work. You work for how much you want to work for. You kind of get to accept, decide if you're going to work for a certain pay rate or not. And you get to work how much you want to work, period. So getting control of your career allows you to regain control of your life, and that decreases burnout substantially. As a matter of fact, I know physicians who are able to use locums as a way to kind of bridge things and to transition into other things that they want to do. So before you, like I said, chuck it all away, and before you hang up that white coat, before you hang up your stethoscope, consider doing locums, because even if it's not a cure for your burnout, it is something that you can do while you are reassessing things. If you want to leave clinical medicine, locums gives you the great transition between leaving clinical medicine, transitioning to something else. If you want to try your hand at non-clinical medicine, doing locums still allows you to keep your clinical skills up, because like I say, once you're out of clinical medicine for 2 years, it is nearly impossible for you to get back in. Hi, Dr. Celeste. Thank you so much for joining. We're just talking about why you should not let burnout force you out of your clinical career. And I'm discussing the Medscape 2020 report on national physician burnout and suicide. And the number one cause of burnout is administrative burden and workplace organizational culture. So that to me says that burnout is preventable, reversible, and treatable. It's preventable in the fact that these places need to really do a better job in lessening the administrative burnout for physicians. It's reversible in the fact that if you remove yourself from that toxic workplace, your love for medicine will come back and you will stop feeling burnt out. And it's treatable in the way that you can assess and diagnose you being burnt out and come up with a plan for treating it. So it is a tragedy for any physician to leave clinical medicine due to being burnt out, because you're making a permanent decision about a temporary situation. And the thing is, when you're going through burnout, you think it's permanent. You think that all places are like this. But I can personally tell you, as a critical care physician who has experienced burnout, that it is not something that is comes with the job and it's just par for the course and we have to deal with it. It's not, because there are things you can do. There are steps you can take. There are work situations that you can enter into that will substantially decrease your rate of burnout. So like I said before, any physician who is struggling with burnout, who is feeling these symptoms of feeling unworthy, feeling like, I'm just a cog in a cogwheel, feeling as though nobody cares about you, feeling as though, nobody respects you anymore, there are 3 things that you can do. And Dr. Celeste says, yes, get out of the stressful environment of burnout. This is my story. And Dr. Celeste is one of my clients who is actually killing the game at locum. She was able to step away from a toxic work environment. She regained control of her life by regaining control of her career. So the 3 things that you need to do when you are facing burnout and you are seriously contemplating hanging up your stethoscope is to get help. Reach out to somebody. Join some supportive groups. The great thing about Facebook is there's so many great Facebook groups for physicians in which you can reach out to people and say, hey, this is what's going on. In the Facebook community, the Facebook physician community is so supportive, and people will be like, this is what happened to me and this is what you need to do, and you are not alone. So those of you who are not a member of my Facebook community, Creating Careers in Medicine, please join. The second thing you need to do is develop an assessment and plan. Pinpoint exactly why you're feeling burnt out and what has contributed to your burnout, and develop a plan. And your plan for treating your burnout could be something as simply as finding another job, because the number one cause of burnout for physicians is undue administrative burden and a toxic workplace culture and environment. And the third thing that every physician needs to do who is burnt out, before you hang up your stethoscope and hang up your white coat and walk away from clinical medicine, you need to continue to do locums, because locums gives you control. It allows you to set your own schedule. It allows you to take control of your career by taking control of your life by taking care of your career. And the bottom line is this: nothing in locums is permanent. So what do I mean? If you take a locums assignment and you don't like the organizational culture of the place where you take the assignment, if you don't like how they're treating you, you do not have to go back. And the fact that you have that level of control over your life will automatically decrease your feelings of burnout. Dr. Celeste says, thank you, Dr. Stephanie, for sharing locum strategies to help me get away from the burnout and help me get my business off the ground now locuming and loving it as I structure my business to practice medicine the way I want to. And thank you, Dr. Celeste, for being an excellent example and an excellent physician, because you were able to use locums to your advantage so that you can do what you need to do and practice medicine on your own terms. You have continued to stay in clinical medicine, but you have taken control of the situation. Dr. LaFera, thanks for joining. We're talking about burnout, and we're talking about this new Medscape report, and we're talking about what every physician needs to do who was burnt out before they walk away from clinical medicine. So I would like to invite everybody who is a physician who is burnt out or who is considering doing locums to download my free locums training video, Getting Started with Locums in 5 Easy Steps. This is free online training. And to download that video, please go to www.freelocumstraining.com, and I will drop the link in the comment section. But also, I want to take this opportunity to announce a very exciting upcoming event that I am hosting in Houston. I am hosting the Locums Doc Summit on May 16th and 17th in Houston, Texas. And this Locums Doc Summit is exactly what it says. It is a summit. It is a conference for physicians who do locums, for physicians who are interested in transitioning into locums. This exciting 2-day event is going to be jam-packed with strategies and tips and tools that every physician can use, not only to get started with locums, but to thrive with locums. I will be bringing in experts and industry-leading experts in the field of locums in order to share with you the strategies of how you can use locums and practice medicine on your own terms. So that is the Locums Doc Summit. Go to the locumsdocsummit.com for more information and to purchase your early bird ticket. And I will be dropping that link in the comment section. So this is Dr. Stephanie. Thank you so much for joining me for this Facebook Live. And I just want everybody to realize, every physician to realize, is that you have hope, that you can regain control of your life by regaining control of your career. We will talk soon. This is Dr. Stephanie. Thanks and bye-bye.